Okay, thank you so much everyone for joining. I think it's slowly letting people in from the waiting room, so we'll kind of let that list build up a bit. But briefly, thank you all for being here tonight, and thank you especially to the TSDA for reaching out and for wanting to put on this event to tell all of us students about the upcoming ERAS cycle, give us some advice in terms of what they've been talking about with universal interview dates, things of that matter. And thank you to you all for joining in to listen. So I'll pass it off to Dr. Killick to do our introductions today.
Good evening, everybody. I apologize for the noise. We'll talk about work-life integration at some other point, I think. I'll just come back to my daughter's soccer game. The new interview cycle is starting up, and there's a lot of angst. As much as angst there's a lot of excitement. This is actually shared by the program directors as well. So I just want you to know that this is not something just for the applicants, but for us as program directors as well. And as we kick off the new cycle, there's a lot of questions, whether it's a virtual format interviews, in-person, universal offer dates, program signaling. There's quite a bit of things going around because everything's somewhat new. And without, we have a couple of short presentations. I'm joined today by my colleagues, Dr. Vita Milewski from Yale and Dr. Sarah Pereira from Utah, who will be giving a couple 5-minute lectures, slide deck on these topics. Afterwards, we'll have a couple minutes to talk about any questions that you may have. In the meantime, there is a chat function in the ultimate Q&A section if you see it on the webinar that you can fill in. We'll try to answer things in real time. But if we see common threads, we may elect to leave it till the end so that we can have a more thorough discussion. With that, I'll stop. We'll have a presentation on the universal offer date.
Can everybody see that?
Yes.
Okay, great. Thank you. My name is Rita Milewski, and I'm one of the cardiac surgeons at Yale University. So I'd like to thank you for the opportunity to talk to you today about the universal offer date. And as you are, most of you are aware that this is the second year of the universal offer date. So just as a little bit of a background, some of the benefits of the universal offer date are that it really benefits both the applicants as well as the program. Specifically, it creates a common timeline, for everyone. And it's really a benefit, like I said, for everyone on both sides. So the universal offer date was created so that all the integrated thoracic surgery programs would release the interview offers on the same date. And this really allows for better transparency, predictability, and actually it decreases the amount of stress and anxiety for the applicants. In the past and in previous recruitment cycles, invitations could have been released anywhere from September to early November. And it caused a lot of problems because the applicants would scrub out of cases, maybe even ask their family members to read their emails in case an interview came out. Again, this way, there is only one date that the residents have to be aware of, the applicants have to be aware of. And the universal offer date is consistent with national recommendations by the Coalition of Physician Accountability, the Association of American Medical Colleges, and the Organization of Program Directors Associations. And it's also consistent with other surgical specialties, including plastics, orthopedics, urology, otolaryngology, and general surgery as well. So as I talked about earlier, there are benefits for the universal offer date. And one of the benefits is that it specifically creates a common timeline for the interview invitation process. And it creates a structure for the interview process and predictability by having it all on one date. It's less disruptive for the applicants who are on clinical rotations and may be either scrubbed into a case or be taking care of patients. It does allow for programs to have a holistic review of the applicants. So it is better for the applicants in and of themselves as well as the programs, because it gives more time for review of the applicants. It also improves the efficacy and the efficiency of interview scheduling, so that the applicant knows when the interviews are coming. And it also provides protected time, and this may be the most important thing, for the applicants to review the interview invitations and then plan for the season. The applicants are provided with a protected time and offers them a 48-hour window to let them look at their invitations for interviews and to plan their season accordingly. So how did this universal offer date work in the year 2023-2024 cycle? So 30 out of the 35 programs participated in the universal offer date. Of the programs that chose not to participate, 3 out of the 5 released their interview dates after the universal offer date, and 2 of the 5 programs released their invitations before the universal offer date. So the majority of programs last year did participate in the universal offer date. Last year, the invitations were released on a Friday, and the students had a weekend to review, and then the scheduling started the following Monday. There was last year a mandatory moratorium on communication that we recommended last year, and some of this will change this year. There was actually some problems with that and some challenges that the programs encountered, because it limited the amount of communication that they could have with the applicants who were sending emails. And it also presented challenges for some of the people who were working with the new thalamus. For changes from last year to this year is that the universal offer date is going to be offered before the general surgery universal offer date. And this will allow applicants to prioritize their interviews for the integrated programs. We do know that, I'm so sorry about this, it keeps going forward, that many of the integrated applicants are going to be applying to both general surgery as well as integrated programs. So again, the goal would be that the trainees or the applicants have an opportunity to take a look at their integrated offer dates before getting the general surgery offer dates, and allow them to schedule their interview season accordingly. This year, there will be no moratorium on communication between programs and applicants, so that when the interview invitations go out, the applicants would then be able to take a look at them and respond accordingly, either the same day or go into thalamus. And we're also moving the universal offer date to a weekday, so that they will, instead of a Friday, so that the applicants, it decreases the pressure on the programs and the applicants, and the coordinators will be able to answer questions that the applicants have. This year, based on experiences of other programs and timelines, this year, programs who are participating will extend initial interview offers to the applicants on Tuesday, October the 22nd, in their usual fashion. And again, this date was chosen because it's one day before the universal offer date for general surgery. The applicants should respond to the interview invitations with an acceptance or decline by a close of the business day on October 24th. So this allows applicants to have up to 48 hours to respond to the invitation before the program then releases the invitation to another applicant. If the programs have unfilled spots for interviews after this first round of scheduling, they can then start sending out additional interview invitations after that 48-hour period. So what is the applicant commitment? Well, it's actually, like I said, better for the applicants as well as the programs, so that the applicants should review all of their interview invitations and thoughtfully plan out their acceptances. They should respond before the 48-hour deadline and not hold interview spots that they don't realistically plan on attending. And it's hoped that the integrated thoracic surgery residency programs that participate in the universal offer date will, they only offer as many interview invitations as spots available. They will guarantee an interview if the applicant responds by the deadline, publicly report their universal offer date either on their website or through social media or communication with the applicants. But like last year, while participation in the universal offer date is recommended, it is not mandatory. And it's hoped that programs and applicants will utilize the honor system and both send out interviews and accept interviews on the honor system. So again, the idea is that the universal offer date will be offered on Tuesday, October the 22nd. It will be 48 hours for the applicants to respond by the end of the business day on October the 24th. And if the applicant or the interviewee does not respond, then the program will send out invitations to unfilled spots. Thank you, and I'd be happy to take any questions.
One brief question based on what you were saying. Is there a number right now of programs who have agreed to participate in the universal offer date, or does that get found out after the fact?
I don't know the answer to that right now. I don't know how many that there are.
The TSDA has put out a statement saying we highly encourage, although it's not mandatory. And we'll have a answer for you, unfortunately, after the fact.
Okay. Thank you so much, Dr. Mileski. As questions come in the Q&A as well, we can address them towards the end.
Dr. Farah, would you like to talk about program signaling next?
Yeah, hey everyone. Let me work on sharing these slides. It's exciting to see 80 people here. I know everybody's high anxiety. Let's see why this doesn't, there it goes. Can you see that?
We can.
Perfect. Perfect. Well, we had a, I'm Sarah Pereira, by the way, for those that I don't know. I'm a cardiac surgeon in Utah. And we had a TSDA interview cycle webinar last week. These are a few adapted slides from that webinar, just with TSDA recommendations to programs about program signaling. And it honestly is an area that we don't have data on as of yet. After the interview season last year, the AAMC collected some data for all specialties on program signaling, and they have a lot of information on the AAMC website that you could all look up. But for thoracic in particular, we just don't have the data yet to know exactly how program signaling works out. So these are some general thoughts. We'll talk about what it is. It's year number 2 also for program signaling for integrated thoracic programs. We do not do program signaling for the independent fellowship programs. How many signals? You all know you have 3 for integrated. And then how should you use your signals, which is the most anxious question of medical students that I've talked to this year in terms of general surgery. So program signaling is all of your opportunity to express your genuine interest in a residency program. All programs use it in a little bit different ways, so we don't know how every single program uses it, but it's intended to be a single data point within a holistic application process. And it really does improve your ability to obtain an interview offer as well as demonstrate your sincere interest in a program. I think most programs will take a double look at students who have signaled. And programs cannot see which other programs you've signaled. So program directors have no idea who you've signaled. The integrated match this year, I think there's 36 programs that have active positions open and are participating. And all of you will have just 3 signals for integrated programs. You know that each specialty has a different number of signals that varies anywhere from 3 to 30 in orthopedic surgery. General surgery has 15 signals. And there are some specialties that have a tier system for signaling, which we do not in thoracic surgery, but like anesthesia has a tier system where they have, say, 3 gold signals and then so many silver signals. And I don't know exactly how the programs use the gold silver, but that's definitely out there that you may hear from some of your friends. So who should you signal? So this is probably the most controversial message, and I don't have a clear answer for you, but I can tell you that TSDA strongly recommends that applicants do not signal their home program or programs where you have completed a visiting elective or sub-internship. So we emphasized that again last week at the TSDA webinar with program directors. I have told all students that I know applying this year not to signal for thoracic surgery, the home program, or the program that you've done a visiting clerkship. But general surgery is definitely sending the message that if you do not signal their program, they will not offer you an interview. And I've heard that at an American College of Surgeons course I was at a couple weeks ago from multiple general surgery program directors. So I think you should definitely keep that in mind. I think the thought is that they don't want to be number 16 on your list. And so if you don't signal them, they're really not interested, even if it's your home institution of giving you an interview. So how should we, as faculty or program directors, advise all of you students to signal? These are just my thoughts. I can't say that these are everybody's thoughts, but these are thoughts just talking to people around the country. I think the I-6 match is really competitive. And so I think you should use your 3 signals to programs that are not your home institution and are not areas that you visited or programs that you've rotated with your top 3 programs other than your home institution and where you've done your clerkships. So, you know, if you've done 2 clerkships and you're at a home institution, you have 6 top institutions, then use your 3 for the other 3 that you really want to go to. I think, you know, it's always important to kind of keep in mind what you may interpret as a reach, a range, or a safe program, especially for general surgery. And so you do want to be realistic. I would definitely talk to your local mentors, talk to people that you know in the match this year, and kind of average all the feedback you get into what you might think is a reach, a range, or a safe program. And most general surgery program directors are advising students to break it up into kind of a tier system of, you know, what are your absolute top programs, what are your middle range, and then what are your programs that you feel are safe for you to interview. And so I already said this, but just keep in mind that most programs will not interview applicants that haven't signaled in general surgery. Geographic preference is a question that comes up a lot that students ask me, and I think it's a difficult answer. So for integrated programs, I think there are so few programs in each state. You know, like in Utah, we have one integrated program. In Colorado, they have a 4 and 3 program. So there's so few programs that I really advise students in thoracic not to use a geographic preference, because it may, you know, limit someone's perception of your application. I think for general surgery, it's a little bit more realistic, or for internal medicine, or for some of the programs where there are a lot of programs in each state, in California or New York or Texas, it would be, you know, probably more to your advantage to use a geographic preference. But that is honestly just my advice of things that I've heard from applicants. So I think I'm happy to answer any questions about this. I think all of us are still trying to figure out, you know, exactly in the integrated matches where the program signaling and universal offer date ends up. The AAMC website does have a really nice program, a nice page on program signaling and how to use it. And that's all I have. So thanks for being here. I think you'll all do great, judging by the enthusiasm.
Thank you very much for that presentation, Dr. Pereira. We have a question in our chat from one of our audience members asking about the importance of geographic preferences, especially if students would be happy to train anywhere. How would you recommend we answer the question of urban versus rural preference?
Yeah, I mean, what I tell students to do, and I think what I've seen the most on, you know, reviewing 300 plus applications last year, is I think the majority of students will write in their integrated applications something like, I do not have a geographic preference in terms of integrated thoracic surgery, that I'm open to train in any part of the country that offers me the best training and fit. That's kind of how people answer it in that way, just to keep their options open. And there really aren't too many rural integrated programs. And so general surgery is a little bit different. And I imagine most of you that are applying to integrated programs are applying to academic surgery programs. And so probably not too many rural options.
Thank you.
So another question that we had gotten through the registration questions having to do with interviews, although not necessarily signaling. Is there a list of programs or a sense of the percentage of programs that will have in-person interviews versus virtual?
In general, the TSDA made a recommendation either one or the other person, and hasn't taken a stand, but wanted to make it as transparent and equitable as possible. So if they do offer in person, to offer virtual options for those that have a identified disadvantage. That being said, we don't know. Once again, we'll have a better idea of what the percentage breakout ends up being at the end of this cycle.
Yeah, I was just going to say about the interviews, I think it's really important that TSDA really recommended to keep it consistent across your program. And so the recommendation from TSDA is to do all in-person interviews or do all virtual interviews. And so the hybrid platform has been discouraged. There is a very special circumstance for the potential of a virtual interview if you're doing in person, but it has to be for a special circumstance such as, you know, late pregnancy or documented financial hardship. And so keep that in mind, because all of us are trying to figure out, you know, what the recommendation for all of our institutions is to do. And I've started to see a lot of programs post their dates on X with how they're doing their interviews, and then the dates.
I think also it is often left up to the institution to determine how all of their residency programs are going to hold interviews. So an institution may mandate through the GME office that all interviews, whether surgical, medicine, emergency medicine, pathology, they're all either to be virtual or they're all either to be in person. So that a lot of programs just don't know yet.
Thank you. We also had some questions from our registrants about any additional recommendations you might have for osteopathic applicants as well as IMG applicants.
Yeah, it's a tough question, Adam, that we get a lot. And I think the honest answer is, if you look at the match statistics that you can pull on AMC, it's just that much harder for an IMG or a DO to match and integrate it. I think we had one DO last year, one the year before, and no IMGs matched this past year in integrated. So I would say to be realistic and really keep your networking options and your general surgery applications, really thoroughly evaluated in terms of places that you apply.
Another question that we got here from the chat, and I think it's kind of a larger question about really the interface between dual applying to both general surgery and integrated programs. So what are your thoughts on signaling general surgery programs with 4.3 that also have I6 programs? Do you think those committees are talking to one another? Will it hurt your chances one way or the other if you signal for both?
Rita, what do you think? It's such a hard one.
That's a very difficult question to answer. We don't have a 4.3. And I know that that's always an angst for any of the applicants that, if I signal, are they going to talk and find out that I'm trying to do both at once? Although I think the reality of it is that we all know that people do, simply because there's only 35 programs. So it's not a surprise to any of us that people apply to, 4.3 general surgery, I6. So as far as signaling goes, I personally don't talk. I don't find out if my applicant is also signaling the general surgery. I just kind of hone in and pay attention to our applicants going through our I6 program. So, but whether others do or not, I'm sorry, I cannot answer that. I just don't know.
Yeah, I would say that, I can only tell you that here in Utah, I know the applicants that apply to general surgery and integrated, and I think it's really frowned upon by general surgery to apply for integrated and general surgery here. There aren't very many 4.3 programs that interview separately for their tracks. And so in general, I think you would signal the general surgery program and then you would go to that institution and then match into 4.3 in your PGY3 or PGY4 year. There's a few I know, such as UAB, that they dedicate one 4.3 spot to the match and interview separately. And I think MGH is the same. There might be a few more.
I just think that unfortunately is a hard question to answer.
Thank you both for your thoughts on that. I know that's not a cookie cutter answer depending on where you are, so thank you.
We have one final question in the chat about some students are concerned about not signaling a program they're highly interested in, even if they did an away rotation at, and how directors might interpret that as a lack of interest. We were wondering if you could speak a little bit about that.
Well, again, I think the TSDA really strongly recommended in the kind of interview document and expectations document that you don't signal your home program for thoracic. I mean, I've told all the students that have rotated here or internal students not to signal my program. So I don't know how Yale is or Hopkins in terms of that.
Yeah, well, TSDA recommendation, sorry if my audio is bad, is that is kind of, if you've done an away rotation, or if it's your home institution, you don't have to re-signal because it's understood, it's inherent to the process. So there's no program that's going to look at it negatively.
I agree with that, the TSDA, like I said, that they are strongly suggesting that that you do not signal your home program or someplace that you have done a sub-I. It's, and again, unless you're viewed negatively, then the assumption is made that you're interested.
And just on a side note, I don't know if there's a means that you could send program directors an email that, you did a rotation and you remain highly interested and, you didn't signal based on TSDA advice or something like that. There might be a nice way to do that that doesn't make you sound too eager or the opposite.
Certainly one recommendation, one could make is to roll that into your thank you note after the interviews, right? It's a nice segue to say, I'm not signaling because of this reason, but I'm very interested.
And then one last question that we had from prior, if that's all right, I know we're over a little bit on time and then we can wrap up afterwards. Do you have any advice for applicants if they receive multiple interviews that are strictly listed for the same day and there are no alternative dates listed?
I think it will be a problem. I mean, I already know dates overlapping with other programs in the West and our program. And, I think you have to, in your little journal of pros and cons of all places, that all places have them, I think just decide what program you think is the best fit for you and your family. And, you could go that approach or flip a coin or something else.
I agree with that. And I think that was one of the reasons for the universal offer date is to allow that 48 hours to, prioritize where you feel that you fit the best and where you think you can train the best. And I think that that's a decision that every applicant needs to make.
I'm looking at a question in the chat on advice on how to succeed during interviews or how the platforms will be. And I think they're all different. Like I've never done in-person interviews at my current institution. I think it's going to be so different than virtual interviews, and I think all programs do it a little bit differently. There are lists of interview questions out there circulating. I know there are, of kind of holistic type questions that you could perhaps prepare for, but you don't want to over prepare and sound kind of rigid. You want to kind of speak from the heart and not be too rehearsed, especially in a virtual interview. It kind of looks bad when you're like reading a script of your answers.
I think another thing too is, and again, I'm like you, have only done the virtual interviews here, but to think of what areas questions may come in from. For example, questions may come in about research, may come in about, you know, what you like to do on your time off, what your passion is within, or especially within cardiac surgery, something like that. And just think of what you might answer. Again, not rigid, but kind of think in your mind what 2 or 3 points you would want to bring up to make sure that you presented yourself and your passions and your love for cardiothoracic surgery. And again, not have a rote answer, but have in your mind 2 or 3 points that you would like to make should that question come up.
Thank you all very, very much. Thank you, Dr. Milewski and Dr. Pereira, for your presentations. Dr. Kilich, Dr. Cook, and the rest of the TSDA for helping organize this. I think this is a very stressful time for a lot of us. So being able to kind of speak and ask our questions directly is always very much appreciated. Thank you so much. And if we get any more questions from students, we'll be sure to email them to you and hopefully share the answers online. But thank you, everyone.
Yeah.
Thank you for the opportunity to present and to speak with you. I really do appreciate it. Thank you all.
Take care. Good luck, everyone applying.
Thanks, everyone. Yeah.